Question number 1. Leafless fruit laden tree or cherry blossom appearance on a xylogram indicates option A. Mucoepidermoid cell carcinoma, option B. Acinar cell carcinoma, option C. Sjogren syndrome, option D. Pleomorphic adenoma. Leafless fruit laden tree or cherry blossom appearance. So here the answer is option C. Sjogren syndrome. So Sjogren syndrome looks like leafless fruit laden tree or cherry blossom appearance in the xylogram. And snowstorm appearance also Sjogren syndrome. The question number 2 is xerostomia, enlargement of salivary gland and lacrimal gland is seen in option A. Sika syndrome, option B. Sjogren syndrome, option C. Mycolysis syndrome, option D. None of the above. So here the answer is option C. Mycolysis syndrome. So what is Mycolysis syndrome? So it is the benign lymphoepithelial lesion. It affects the lacrimal and the salivary gland and xerostomia. These are the only features in Mycolysis disease. If it is Sika syndrome, there is dry eyes and dry mouth. That is xerophthalmia and xerostomia. If it is secondary Sjogren syndrome, dry eyes, dry mouth and collagen disorders, that is rheumatoid arthritis or systemic lupus erythematosus also present. So question number 3, xerostomia is seen in all of the following except in option A. Anticholinergic drugs, option B. Dehydration, option C. Sjogren syndrome, option D. Oral sepsis. What is xerostomia? It is a dry mouth. So here the answer is oral sepsis. Xerostomia is seen in all but not seen in oral sepsis. Question number 4. In which of the following statements about Sjogren syndrome is incorrect? Option A. MRI shows salt and pepper appearance. Option B. Lacrimal gland enlargement is common. Option C. Minor salivary gland biopsy is a diagnostic test. And option D. Pilocarpine is the most useful and convenient drug in its treatment. So here the Sjogren syndrome, there is lacrimal gland enlargement is not common. Parotid gland enlargement is mostly common. So the answer is Sjogren syndrome is incorrect in lacrimal gland is common. So and question number 5 is Sjogren syndrome effect. Sjogren syndrome affect option A. Exocrine gland, option B. Paracrine gland, option C. Endocrine glands and option D. Autocrine glands. So Sjogren syndrome is an autoimmune disorder and it predominantly affects the salivary, lacrimal and other exocrine glands. So the answer is exocrine glands. So the answer is exocrine gland. Sjogren syndrome affects salivary, lacrimal and other exocrine gland. The sixth question is microscopically epimyoepithelial islands are typically seen in option A. Sjogren syndrome, option B. Mucoepidermoid carcinoma, option C. Epithelial myoepithelial carcinoma, option D. Myoepithelioma. So here the answer is Sjogren syndrome. And epimyoepithelial islands is the finding for Mycolysis disease. It is very important. Sjogren syndrome also